So, thank you. I would like to speak on a new device to treat carotid aneurysm. You know that carotid aneurysm, extracranial aneurysm, is an unusual lesion which could be asymptomatic or symptomatic with neurological symptom due to embolism. As any aneurysm, this kind of aneurysm can embolize and give TIA, stroke. We may have also symptoms due to compression, and the rupture is very rare. Most of the time it's an atheromatous disease, but you can find also FMD and aneurysm with Marfan, Hilaire dans l'os, Besset, etc., and trauma, pseudo-aneurysm. So how you can treat this aneurysm? Surgery, yes, but it's always with high risk. Risk of perioperative stroke in 6 to 19%. So mortality and 5-year patency is not too bad. And if you look at the Texas Heart Institute experience with 67 patients, you can see that death major stroke is high, now 9%, minor stroke 1.5%, and with a lot of cranial nerve injury. So surgery is maybe not the best option. Now we have endovascular treatment, and as for any peripheral aneurysm, you can place stent plus coils or cover stent, but we don't have a very large published series, so it's difficult to know exactly the prognosis of this kind of treatment. And in this systematic review with stent graft, you see the result, procedural success 92%. You have embolics with this kind of techniques in 8% of the cases, stroke, cranial nerve injury, also mortality 4%, and stent graft patency 93%. So also it's maybe not the best solution to treat this kind of aneurysm. So I treated several years ago a patient, a male, 65 years old, diabetics, high blood pressure, triple vessel coronary disease with unstable angina, and you can see this aneurysm, large aneurysm. What to do? Nothing, surgery, angioplasty. So I treated this patient with a cover stent. You see this aneurysm. So I implanted a wall graft with a nice result at 1 year, and I followed this patient for 5 years without any problem. So it was a good result. But maybe the future is not in cover stent, and maybe is this new prosthesis, a multi-layer flow modulator, which is a stent which is not covered. It's not a stent graft. This stent is made of 2-3 layers depending on the diameter on the artery, and you can implant this stent by femoral approach, retrograde approach, brachial also if you want. I did one with 8-frame sheet, and I want to show this intracranial aneurysm was treated in Argentina by Pedro Lidic. And that's the first intracranial aneurysm treated in the world 4 years ago now. And you can see in a female, 60 years old, and you see a very good result, excellent result at 4 months follow-up. But now I think that Pedro Lidic had at least 50 patients treated with this kind of multi-layer stent, and with very good result and better result than with techniques you can find in the literature. So the aneurysm was totally excluded. I treated 3 months ago external carotid aneurysm in a male 60 years old, high blood pressure, also triple vessel disease, and you see this aneurysm with a stenosis at the ostium. So I place an Acunet filter. So I did that under protection. I dilated the stenosis at the ostium, and under protection and implanted multi-layer stent by a femoral approach, and you can see the result at 3 months follow-up. It's totally excluded without compromising the external carotid artery. So with this kind of stent, we don't compromise the flow in the collateral branch. We can cover any branch, and in the afternoon you will see for other peripheral aneurysm or thoracoabdominal aneurysm, we can place a stent in front of any branch without any problem with this branch. And I treated also a case of subclavian artery aneurysm, and from this aneurysm you see the takeoff of the vertebral artery. The vertebral artery was involved in this aneurysm. So by brachial approach, it was very easy to precisely place the stent, deploy the stent, and you can see at 3 months follow-up an exclusion of this aneurysm, and the vertebral artery is widely patent. So you can cover any branch, you don't compromise the flow. So that's, I think, the technique of the future. And yesterday we saw a huge subclavian aneurysm, and I think that's the indication for this kind of stent. Thank you for your attention.
Michel, what are the other alternatives apart from this? What other stents do you use for aneurysms apart from the...
Now I use this stent. If not, if I don't can use this stent, cover stent. But honestly, that's the best technique. And I hope you will have this stent in the near future in India.
I'm a neurointerventionist, so we are using it in Indian intracranial aneurysms. In our own practice, we are not able to use it in peripheral, mostly because of cost issues as well. These are extremely costly as compared to the regular stents, but we are using them regularly for intracranial aneurysms. For dysplastic aneurysms, they are clearly a huge evolution. But I can imagine a patient can, in Indians can afford, it's a very good option for dysplastic aneurysms. And if it doesn't work the first time with one stent, you can always place overlapping one later on, and then slowly they tend to go away.
Thank you very much, our eminent presenter, Monsieur Michel Henry.